Okay, Dr. Anurag. So we would love to talk about wrist pain in software engineers.
See, this is a very common area to get a pain. Basically, there is a nerve called median nerve, which is passing from here, and because of constant typing and keeping this wrist in this position, the nerve can get compressed. So the symptoms are like sometimes sharp pain, and sometimes you may experience a pain which is like numbing or tingling in this part of the hand, not the entire, only the first half of the hand.
And typically, what day-to-day activity causes this pain?
As I said, if you are working on the system for a very long time, when the wrist is in this position for a very long time, this is the reason for getting this compression.
Why does this pain commonly occur with software engineers only?
Because see, it is in a constant position. If you are in an activity which is changing the wrist position, then it may not happen. I'm not saying that every software engineer will suffer from this, but if you are suffering, this is the major reason.
What are the early signs people should watch out for?
The earliest sign is, as I said, pain. Okay, so if only one side is affected and every time you are spending certain amount of hours on the system and you are getting that discomfort, and rarely when that discomfort is increasing to a tingling, that is a time that you need to meet an expert.
Doctor, what can people do about wrist pain?
See, if you are experiencing the wrist pain like the way I have explained, then what you can do is you can try to keep your wrist in a neutral position by folding a hand towel and keeping it around this area, okay? So that the wrist is not into complete extension or flexion. Or you can use ergonomically advanced mouses, or in between what you can do, you can decompress the wrist by stretching this and this. You can hold them for 5 seconds and repeat 10 repetitions.
What are some of the red flags that people should be aware of, and how should they go about seeking help?
The most important red flag is having tingling and numbness in this part of the hand. If we are talking about a carpal tunnel syndrome, which is due to compression of the nerve which I mentioned.
Doctor, what is carpal tunnel syndrome?
Carpal tunnel syndrome is a syndrome where the nerve called median nerve is compressed in the wrist area from where it is passing, and this leads to pain and tingling numbness in this part of the hand.
What does a severe carpal tunnel syndrome look like?
Severity is tingling numbness in the hand, not able to function properly. You will lose proper control of the grip.